that, I am super excited to now bring on Lauren Sherwood, and we get to dive into something that I didn't even realize that there was a solution out there that Lauren opened my eyes up to. And that is Medicaid and Medicaid waiver. Is that anytime I heard about Medicaid waiver, it was this 3 to 4 year waiting list, and why even put your name on that list. But Lauren's going to share some strategies and some options for us today that I think are going to be great, especially for those who are serving older adults in Virginia. But my hope is that we can help Lauren help other people in other states down the road here. But Lauren, before we dive into the topic of Medicaid and Medicaid waiver, let's get to know you a little bit better. Tell us a little bit about your career path and what led you to this area of specialty.
Sure. So I graduated from Virginia Tech. So I don't know if we have any Hokies on here,
I know
but
we do.
and I got a master's in political science, was determined to do something that made a difference in the world. And I am a mother of 3 girls, and my middle daughter was born with some disability. She has a seizure disorder and had some brain damage associated with that when she was born. And I quickly went through the Medicaid waiver world firsthand as a parent of someone who needed services, and discovered that I was passionate about helping those with disabilities or aging parents, aging family members get the services that they needed to be successful in their community. And now I work for At Home Your Way, the Director of Client Outreach, and excited to share with you guys a little bit today about what waiver types are offered in Virginia and how you go about getting screened for one of those waivers.
Yeah, and for the folks on the call that might not be in Virginia, stay tuned, because I think we're going to have an overall discussion about Medicaid and just how do we take care of our clients that don't have means. What are some of the strategies? And I'm counting on the audience being just as much of a contributor as Lauren. And in fact, I want to recognize Albert, who emailed me before this event even started. And I hope I'm not putting you on the spot, Lauren, but before you begin your PowerPoint, what I was thinking is, let me just read you these questions that Albert asked. They may resonate with some of the people in the audience. You guys may have additional questions, which you do, type them in. But hopefully, Lauren, you can answer these either throughout your talk with your PowerPoint, or at the end, we can swing back and dive into them. So The first question Albert asks is, what is the processing time for an application for long-term care Medicaid if the future applicant is currently in a nursing home on a private pay basis and will stay in the nursing home under Medicaid? So that's an interesting scenario he's presenting. Then he also asks is, how much in resources is a future applicant allowed to have at the time of applying for Medicaid, recognizing that someone must pay for room and board in a community or facility while the application is being processed. So yeah, you're spending down. And then the last thing he says, is there a state or local waiting list for long-term care Medicaid in a private facility? If so, how long is it? Is any list public? And so those are some things for you to stick in the back of your head. And when we kind of get through this, if you don't address those, I'll bring them up. And Albert, I hope you're tuned in and can hear our answers. So I'm going to drop behind the curtain here, and I will just jump in if there's any relevant questions, and take it away, Lauren.
All right. Yes, we will definitely circle back to those questions. Some of them will be answered throughout this. And Steve, make sure you remind me if we don't get to all of them. And then if you guys have additional questions throughout, we'll kind of pause and take those. So you guys should be able to see my screen now, and we'll just kind of jump in here. So if you have not heard of At Home Your Way, just a little bit about us. We have been serving over 7,000 families consistently since 2009. We're currently the largest provider in the Commonwealth. And a lot of our staff members, much like myself, have been through this process with one of their own loved ones. And so they've experienced it not only from the professional side of things, but from a personal level as well. And what we do is we assist families kind of navigating that Medicaid waiver. We like to call it a maze, from the screening process right up until they receive services in the home. And we provide service facilitation to those on Medicaid waivers. And so we do monthly visits after they get services started and make sure that they have everything that they need to meet those needs, so that they get to choose how they spend their days in the community. And so want to talk a little bit about the mystery that is Medicaid waivers today. Most people are familiar with Medicaid as kind of the program that's run by the state. And I know Steve mentioned earlier, we're talking primarily about Virginia right now. We are looking at some other states' programs. They're all a little bit different. So the states are the ones that manage Medicaid. It began as a joint program in 1965, and most people are familiar that it provides health care to low income and pregnant women and children. What a lot of people don't realize is there's a whole nother group of Medicaid that's a Medicaid waiver that provides health care to elderly or disabled individuals, and that's primarily what we're going to be talking about today. Originally, when Medicaid was established, they required that those dollars be spent for long-term care in facility settings. And then as states moved away from institutionalization, they changed that to where the state could then the individual could choose to use those dollars either in the community. So if they wanted to stay in their home, they could then use that waiver that way, or they can use it in a facility if that's what they choose. But just a lot more person-centered freedom of choice. You should get to choose where you want to live. And as a state, Virginia realized that, and that's when these waivers were kind of created that could be used in the community as well. So what is a waiver? Like I said, originally they required that money be spent in facility-based settings, which there's nothing wrong with that if that's where you want to be. But on the flip side, we also have seen that it's not super cost effective for individuals to be in facilities. And so the states created waivers where the money can then be spent in the community. And when we talk about a waiver, the reason that that word is used is because once you qualify based on your medical needs, then the economic status of the household is waived, and they look only at the economic status of that individual. So we commonly see a misconception of people that come to us and they say, well, I would never qualify for Medicaid. My household income is too great for me to qualify. And that's when we get to tell them, hey, did you know that if you apply for a waiver and you qualify based on your needs, they actually only look at that individual's income, not the full household, which means a lot more people qualify than they think they will. So what are some benefits of the waiver? The big one that everybody gets really excited about is medical coverage. So it covers everything that's medically necessary, whether it be therapies, hospital admissions, things like durable medical equipment, supplies, prescriptions, if you need incontinence supplies or supplements, diabetic supplies, even travel to medical appointments. If a family does already have primary insurance, they can still qualify for this, and Medicaid would just become their secondary insurance. So it truly covers a lot of the medical needs. And then it also allows for the individual to have a personal care attendant. And I know that's something we talk a lot about as our loved ones age and their needs develop and they need more assistance, maybe someone to sit with them and supervise or assist with those activities of daily living. And that's something that's covered with the waiver as well. Before I jump into the different waivers in Virginia, Steve, do you have any questions so far that have come in?
Actually, yeah, well, I want to give a shout out here. It looks like Spencer Garrett says he's Virginia Tech class of 92. He says, go Hokies.
All right, go
Yeah,
Hokies.
but we did have a question on waive, and this is a question that I have too. Whenever I hear about the waiver or Medicaid or anything that's serving the low income, it's just these endless waiting lists, and the are the waiting lists on some of these more manageable?
Yeah, absolutely. So that's actually what I'm coming to now. So that's a
Okay.
perfect
Oh, geez.
segue into
Okay.
that.
Great. Okay.
So there are a couple different waivers in Virginia. The first group of waivers are the developmental disability waivers, and those are the ones that do have the really long waiting list, like you're mentioning. We hear of people that are on those waiting lists for years, and a lot of times people become discouraged when we start to talk about Medicaid waivers because they think, well, if I need services, I need them now, right? You don't need them 7 years from now. So a lot of people, I think, tend to not go through the application process because they've heard these horror stories about how long the wait list is. But the encouraging news is there is another waiver called Commonwealth Coordinated Care Plus, or CCC Plus, and there's actually no wait list for that waiver in the state of Virginia right now. It does serve individuals of any age, and it provides those different services for successful living, nursing, respite, assistive technology, and environmental modification. So there's a lot of resources available through that waiver and no waiting list. You may have known it as the EDCD waiver. That was the old name for it. So in 2017, the EDCD waiver, assistive tech waiver combined together to form that CCC Plus waiver. And like I said, it's for individuals of any age. There's no waiting list for that waiver. And you can utilize services either through an agency where someone, comes into your home to care for your loved one, or you could follow the consumer directed model where you get to hire someone to work with your loved one yourself. So there are some different options available through that waiver. So what everybody always wants to know is, how do I apply for this waiver? The first step is to contact your local Department of Social Services. They're the ones that administer this waiver, and you would need to request a screening. They may ask you why you need a screening. You do need to be prepared to identify those needs. So to describe why your loved one may need more assistance. You cannot be denied for a screening, so you have a right to be screened, and you don't have to have Medicaid to be screened. So you can call and schedule that screening. What it looks like is representatives from the health department and social services, so usually a nurse and a social worker, will complete something that's called a UAI. It's a uniform assessment instrument, and it's basically a caregiver interview, and they're going to ask questions about the individual's activities of daily living and how much assistance they need with those. any medical or nursing needs, and then if they're at risk for nursing home placement. Another place that the screenings can take place is if the individual is hospitalized. So typically hospitals have a social worker on staff that can do the screening there as well. So it doesn't always have to be done at home. But if you're already at home, you would call the social services office. And then if you're in the hospital, you could always request that a social worker do that screening. I want to talk about what the criteria is, but I just want to pause and see if there's any questions about that piece so far.
No, we're good to go.
All right. So the criteria to qualify for the CCC Plus waiver, there's a couple different, it's kind of a three-pronged criteria. The first one is, of course, there is a financial criteria, but it is based on that individual's income, not the entire family or the household. And I'll go over exactly what those numbers are here in just a second. There's also a functional criteria, and what that is they're going to look at what we call the activities of daily living. So the things that you do on a daily basis, eating, dressing, bathing, toileting, moving about your home, things like that. And they're going to evaluate what level of assistance is needed, whether it be supervision or hands-on assistance or what we call mechanical help. So something like using a walker or grab bars in the shower, things like that. And they're going to ask really questions of the caregiver about, well, how much assistance does the individual need with these things? And we always encourage families, I kind of coach families through this ahead of time, really think through all of the things that you do every day for your loved one when you're caring for them, because I think that we as caregivers tend to do a lot more than we even realize. We're so used to taking care of those that we love, and so we jump right in and do all these little things that without the caregiver, the individual would not necessarily be able to do. So for example, when we think through something like bathing, can the individual turn on the water, get in and out of the tub safely without risk of falling? Can they bathe themselves completely? Would they bathe without prompting to do so? Really start to finish of these activities. When we think about eating, can they prepare their own meals? Does their food need to be cut up into small pieces? Are they on a certain diet? Things like that. So really thinking through start to finish what all is involved. And sometimes it's helpful when the screening takes place if there's someone else home that your loved one could meet the screeners and then go maybe to another part of the home so that you can speak real openly with the screeners and let them know exactly how much assistance is needed. And then the third criteria is a medical or nursing need. And there's a couple different choices that Virginia acknowledges as medical or nursing needs that you'll see here. But two of them that a lot of people fall into the category of are the cannot self-assess or monitor. So those with maybe some memory concerns that are on that journey with Alzheimer's or dementia, can they truly self-assess and monitor? Do they know when they're going to need help? Can they identify those things? And then the other one that a lot of people fall under qualification with is that multiple complex interrelated conditions. And what that means is you've got multiple diagnoses going on. So if you have an individual that maybe has diabetes and dementia or something like that, where there's multiple things happening and there's interrelated conditions which could lead to like a medical instability type of situation. We do have a website. I'll share that with you at the end. And we do have a self-help screening tool where you can go through and kind of answer the questions as the individual would at the screening and see, it'll kind of run it through a filter and let you know if you might qualify or not. And then the big question we get a lot is, well, what about this risk of nursing home placement? What does that mean? This is a regulation, but it does not require that the family put the individual in a nursing home if they don't get help. So what they're going to do is they're going to ask you, are you at risk for being put in a nursing facility? if you don't get help within the next 30 days. And a lot of times caregivers, especially if the individual has wanted to stay in their own home, they're hesitant to say, yes, we are at risk for that, because they're afraid that that kind of commits them to, if nothing happens within 30 days, then they have to go into a nursing facility. And that's not at all what that means. They're truly just trying to assess what level of assistance that you need at that point. And there's a couple ways that you qualify for that. Either they've been accepted to a nursing home already, or their health is deteriorating and maybe their natural supports are decreasing, like their primary caregiver has increased work hours or different things going on, such that they would require nursing home placement. Or an attending physician can write a letter stating that this individual does have healthcare needs that cannot be met at home without additional services. So there's a couple different options there. So if the caregiver is struggling to kind of keep up with the needs of the individual and isn't going to be able to continue without some assistance, they would qualify for this imminent risk piece of things. There are a lot of services available. I think we talked about this a little bit before. Everything from adult day healthcare to assistive technology. So when I think of the aging population, assistive technology, we think about things like maybe door alarms for people that wander, or like a GPS type of thing if someone wants some independence, but their caregiver needs to be able to check on them from time to time. Environmental modifications, we think of things like the grab bars to hold on to get safely in and out of the shower or bath. If the individual uses a wheelchair, things like widening the hallway for the chair. There's all kinds of different options that are out there that they would qualify for with this waiver. Nursing care is also something that is an option up to 16 hours a day, depending on, what level of nursing that they would need. Home health nursing, personal care. So we're talking about that person that can help provide them with assistance on those activities of daily living or taking them to appointments, monitoring that health status. Personal emergency response systems. So this is that I've fallen and I can't get up button that you can push to summon for help if for some reason you have a fall at home. Respite care. So every good caregiver needs a break every now and then so that you don't get burnt out and you can take care of yourself. So this would provide some relief to that primary caregiver. And then service facilitation, and that's where someone comes in, checks with you monthly, make sure that you're getting the services that you need. They can request for an increase in services through the insurance company if that's something where your needs have increased. So a lot of good services built into this waiver. And I know one of the questions that came in was, what about the financial piece? What does that look like? And so that is a really good question. I want to touch on that for a few minutes. Like we've covered before, it is based on the individual's income, not the whole family's, which really broadens that eligibility. You do have to be found financially eligible, but for individuals receiving the waiver, this year's monthly individual income limit is at $2,349. And then the resource limit is $2,000. But I do want to be clear that there are lots of options for either spend down. So if you have too much, there are options where you can spend it on your care. So when you reference the individual that was already paying for their own care in the nursing facility, this is definitely an option for them if they have more than that in their account, but they can prove that they're going to spend it on their care. That would not disqualify them from that. And there's also allowances for things like other family members. So if the aging individual has a spouse in the home, there's certain allowances for them to have more in resources or more income if they have someone else in the home with them as well. You can always have a primary residence and a primary vehicle as resources also. If in doubt, though, contact social services because that calculation gets really complex and there are all kinds of options they can communicate with you. Um, there's even an option to do like a patient pay where maybe you qualify for Medicaid almost, but you're a little bit over. So you have to private pay for a small portion of it and you qualify for the rest being covered. So there's tons of options that I know is too much really to get into this. But we never tell people, hey, you definitely won't qualify. You can always contact social services and they can kind of go through the options for spend down or to qualify there. I want to pause and see, or
Yeah.
did that help answer questions? Have more come in?
Oh yeah, no, we got a couple that came
Okay.
in. Let's see. Does Cynthia asked, does Virginia have a TBI, which I'm assuming is traumatic brain injury waiver? And if so, is there a wait list? That's one question.
Okay, so they do not have a traumatic brain injury waiver, but there is a traumatic brain injury grant fund that they can apply for. There are rules about how long it's been since the injury took place versus when you apply. So I don't know exactly what those are, but it does exist. It's just not a waiver. But those with traumatic brain injury can apply for the CCC Plus waiver.
Okay, great. And then let's see, Lynn or Cynthia says, does Virginia have specific residency requirements that apply for long-term care insurance? If so, can the requirements be waived if the resident is transferring from another state to Virginia? For instance, the state of Delaware will waive the requirement if the resident is admitted within 30 days. And then she also says, if the resident's income is over 2349, does the state of Virginia utilize the Miller's Trust?
Okay. So
Any,
as far as the residency requirement, at the time that you're screened, you just have to have your primary residence in the state of Virginia. So you don't have to live here for a year or anything like that. You just have to have a primary residence here in the state. So not a super strict requirement there. And as far as if your income is over, I'm not super familiar with the Miller Fund, but they do have those spend down options. So that's usually what they encourage you to do is like if your money is delegated a certain way for certain parts of your care, they can work with you on that and getting you qualified.
okay, great. And then let's see, does Victoria asks, does the resource limit refer to the dollars to receive? What's the difference between income versus resource limit?
So your resources would be like your savings. And then your income is your month to month that changes, that you're getting continuously. Your resources more what you've saved, what you put away.
Okay. And then lastly, Mark says, I wanted to hear what those options are to qualify, hoping for a little more detail in that area.
And I would love to get more detail with that, but it truly, there's like 30 different ways you can qualify and it's pretty complex. So it's best addressed on an individualized basis.
Yeah, I think you're doing a good job of giving us a good overview, but it's clear that this program is unique and can be customized, and everybody can get some individual guidance on how to utilize it if they qualify. So, Mark, if you find that you're still sort of questioning that, I would encourage you to contact Lauren directly and maybe get a little bit more detail.
Mm-hmm. Absolutely. All right. So then we sometimes run into questions about, well, how do you maintain eligibility? We've talked about how you initially qualify. After you're established, how do you maintain that eligibility? you have to regularly utilize those services. So if they see that, if you choose to stay at home in the community and you're using that community-based care, you have to be regularly utilizing that. So if you're not using personal care, you're not using respite, things like that for a period of a couple months, then they're going to question, is it necessary for you to have this waiver? They also, social services sends a financial eligibility update each year that you have to fill out and turn back in. I always say that's their way of making sure that you didn't win the lottery and disqualify yourself from needing this assistance. So as long as you complete that and you're regularly utilizing those services, you maintain your eligibility. And so we really recommend to families that you apply for that CCC Plus waiver because there's no waiting list for it. We recommend that you start there, and that way, if you are approved, you can immediately start to get those services. If you call us, we can help talk you through that process individually. We can follow up with you throughout that application process. That's something that we just do because we feel like it can be really confusing to go through the process, and we want to make sure that you have somebody there on that journey with you to help walk you through it. And then once you're approved, we can work with you to get services started. So there is a phone number that you'll see on the screen, that 844-828-5591. We have a team of family resource specialists that really know the ins and outs of what that screening process looks like. If you have additional questions about it, you can call us and we can help you determine, if you might qualify, what the next steps are. We can talk you through all the questions. We have a copy of the screening, so we can talk you through the questions that'll be asked, and really be here to kind of be your right hand through this process. So please, if you think this is something that might benefit your family, give us a call, and we're happy to help. What other questions do you have, Steve?
Let's see. It says, here's somebody asks, thank you so much for this education and information. Consumer-directed care. Could you explain this more? You said the consumer can hire a family member or person of their own choice. Does this person have to be on Medicaid? And do they have to have needs assistance with aids with daily living? This all gets so confusing and complicated. So.
All right. So once you're approved for the waiver, there's really two different models of service delivery that we talk about. There's an agency directed model, which is where you work with an agency who employs personal care aides. They are responsible to train them. They take care of their payroll, their hours, all that stuff. They work with you. They would send that aide to the home to take care of the individual. A lot of people choose that because it doesn't require a lot of responsibility on the part of the family. They work with a company that takes care of all of the pieces of the paperwork and all that stuff. There's another model of service delivery if you want more control over the services, and that's the consumer directed model. And that's where we would come in and we would train someone in the home, whether it be the primary caregiver or someone else in the home, to be what we call the employer of record, which basically means you're the boss of those services. And then you would be able to hire someone that the state would pay to take care of your loved one. And so that's something that families choose if they want a little more control over who is serving as the personal care aide, what that schedule looks like, and who's coming into the home. But it does require a little more responsibility. So you got a little more paperwork to do. And if, it's your responsibility to hire that aide, and then if they quit, like, you would have to find a new one. So it really makes you the boss to direct that care. And so some families prefer that. There's not really a right or wrong way to do it. It just depends on your family dynamics and what you're able to do. So you can go either way. That agency is a little less responsibility, but a little less control. And then consumer directed is a little more responsibility, and then you have all the control. So it's just up to personal preference, but you can do it either way.
No, that's great. And so David has a question/comment. I'm perusing your website. And I see you not only address At Home Your Way, but also Moms in Motion, which would help those parents with children with special needs. Is the engagement process similar as it pertains to waivers? I'm currently in the throes of setting up a special needs trust for a grandson. You have a wonderful agency.
Yes, that's a great comment and question. So I know the population I'm talking to today is primarily concerned with the aging process. We kind of do business as either name. So we've got two sides. We serve families who have little ones with special needs, and then we serve the aging population as well. And it's very similar service delivery. So if you need any assistance with setting up things for your grandson, we can definitely serve you as well. We serve all ages. So we've got everything from 6-month-olds. And then I think our oldest individual that we serve is 103 years old. So wide range there. And we're passionate about people receiving services no matter what age and their ability is.
And I tell you, like, I know a friend of our family has a son with cerebral palsy, and I saw the amount that she went through to learn the Medicaid system and to navigate it all on her own without assistance from an agency like yours. And it never dawned on me that, you know, it's Medicaid and that this could be applied to the older adult population that I've been serving for 32 years. So obviously when I stumbled into you guys, I was just thrilled. Abigail says, do you only serve certain counties in Virginia, or do you serve the whole state?
We serve the whole state.
And then piggybacking on that, I know this question is going to come up because I had the same one. Does Maryland have a similar program for its residents?
Yes and no. So each state kind of has free license to run their Medicaid program how they choose to. So every state in the United States has a Medicaid waiver program, but they differ pretty widely from state to state. So I know North Carolina is very similar to Virginia's. Maryland's is very different. So some of them do have waiting lists. Some of them have specific waivers for different abilities. Like I know there are some states that have an autism waiver that Virginia doesn't offer. So it does vary pretty widely, but usually social services for the county that you live in, regardless of the state, can let you know what's available.
Oh, Abigail, I missed this one. Abigail says, what is the cost of talking to a resource specialist At Home Your Way?
There's absolutely no cost to you. So we are really passionate. Like I said, a lot of our team members have been through this on a personal level, and we know, much like Steve shared about his friend, it's hard to find this information and it's very confusing. Each county does things a little bit differently. So sometimes even if you know how it works in one county, it doesn't work that way in another. And so when we were founded, the owner of the company actually is a mom that had a son with autism that went through this process trying to get her son services and said, there's got to be a better way to get this information out there. It shouldn't be a secret club that you join. And so she started this organization. And so it doesn't cost you anything to talk with our family resource specialist. We bill Medicaid for our services after people get the services, but we offer pro bono resource coordination ahead of time and can consult with you at no cost to you.
Yeah, so this is like, you know, I since I've met Lauren, I've probably sent 2 or 3 people her way, because if you're working with a client that you feel may be a match from a financial perspective, it's they can ask the right questions to determine whether that client is would be able to apply, and then kind of serve as a consultant in that. So definitely a great service. Does Medicaid waiver, VA Medicaid waiver, provide families environmental assessments and adaptations? And you know, piggybacking on this one, we have a lot of providers in our audience. Like I know that there's adult daycare, there's home care, there's modifying, putting up grad bars, things of that nature. For the providers in the audience, linking up with Lauren is a great solution, because when you're talking to those providers that are interested in your services, but then you get to the cost and they're sort of like, my mom's on a fixed income, that's where talking to Lauren, seeing if they qualify for this program, might be able to access your services.
Absolutely. And those environmental modifications, that's what we call it in the state of Virginia. It there's an allowance for up to $5,000 a year towards environmental modifications if they're necessary. So if you have a loved one that, their home was just fine for them before, but now they need some modifications made to it or adaptations, then they have, with the waiver, up to $5,000 a year for environmental mods, and then $5,000 a year for assistive technology. So that's your portable pieces of technology that they might need for day-to-day life, things like those door alarms or GPS trackers, things like that.
Great. And then let's see, Jessica says, since there isn't a residency requirement, will they backdate coverage up to how long once it's approved?
So they go from your application date. So the day that you apply and have that screening done, that would be the day that your Medicaid would be effective back to. And they do require that you live in the state of Virginia, just not for any amount of time. So once you call and get that screening scheduled, the day that they come out and do the screening, that's the day that it would be effective. So the sooner the better with getting those screenings scheduled.
And like, for those people in the audience that are sort of like, oh, wow, maybe mom could move to Virginia and qualify. Is there sort of a timeline? Do you have to be a resident for a year or anything like that?
Nope, it just has to be your primary residence in the state of Virginia.
Okay. Cheryl Bartholomew asked a question that I'm eager to work with Lauren on, and is there a directory that can easily access and find organizations that provide similar services as At Home Your Way in other states? And that's something that I would like to work with Lauren on, because as she had mentioned, not every state has a program like Virginia, but if we can identify the ones that do have programs like that, I think that would be very helpful. And I did see in chat, Mark says, I do Maryland Medicaid planning, and it is very different.
Yes, and we do want to work together to try to find more resources across the state. And we have even eyed and toyed with the idea of expanding to other states with our services as well. It's just, it gets kind of complex as it's so different, like Mark said.
Yep. Zena says, can family members be caregivers and get paid by Medicaid waiver?
They absolutely can. And that's something that a lot of caregivers don't realize, is you could continue to do what you're doing, but actually get paid for it through the Medicaid waiver. So there are a few requirements. A spouse cannot be paid to take care of their spouse, but a child can. So if you're taking care of your mother, for example, you could get paid to do that, or any other family member. The only thing is they have to be over the age of 18. So they have to be an adult and pass a criminal background check. But if they can do that, then they can serve as the personal care attendant. And so that is something that a lot of families choose to do, just because they like to know who's taking care of their loved one, and it can help, you know, create an income person that's serving as a caregiver. So definitely an option.
And then someone asks, so with the CDC consumer directed care model, do you still need to qualify for Medicaid?
You do, because Medicaid actually directly pays those people that you employ. So For example, if I was caring for my aging mother and I decide to hire, my sister to care for her as her attendant, I don't handle that money. That money would come directly to my sister in a paycheck through Medicaid. So you still need to qualify so that those services are paid.
Okay, and Maher says, yes, Maryland has Medicaid waivers. I believe, I know we've got some Maryland Medicaid experts on, maybe you could drop it into chat, but I don't think the Medicaid waiver has, in Maryland, has a program like this where you could actually not be on a waiting list and get access to services. But Yvette is requesting that Mark Bobatek drop your contact information into chat there so people can get in touch with you because you do the Medicaid in Maryland. Let's see, Dennis Jones says, I need assistance for a client in Florida. Do you have any idea if Florida has a program similar to Virginia?
They all have to have Medicaid waivers. I'm just not sure exactly what the criteria is for Florida.
Okay. And then does a Medicaid partner with companies that provide certain services such as assisted devices, or does Medicaid partner with companies that provide certain services such as assisted devices or emergency response units?
Yep, absolutely. So that's all covered as part of the Medicaid waiver. There are
And
lots of companies that provide those services.
And is there something, because I know we've got some of those companies in our audience, do they have to be certified somehow through Medicaid, or can the consumer sort of say, oh, I qualify for the waiver and I want to get my Lifeline from Virginia Hospital Center. Does Virginia Hospital Center have to be registered on a list or anything like that?
You just have to, they would have to be credentialed with Medicaid as
Okay.
part of their billing, just like with any insurance, like before you go to the doctor, if you have Anthem insurance, you got to call and make sure they take Anthem. So as long as they are credentialed with Medicaid and accept that, then you're good to go.
Okay, great. Let's see. Tracy asks, when using Medicaid waiver, how many hours of caregiving are covered in a week or a month?
It's a great question, and it is completely needs-based. And that's one of the beauties of this waiver is that there's a needs-based assessment done, and it's frequently done and can change. So it may be that you come into the waiver and 25 hours a week of care is perfectly sufficient for you. And then as your needs progress, as sometimes they do, as you're aging, your level of care increases, then you may qualify for 40 hours or 56 hours or whatever. So they can always reassess, but it's based on the individual's needs at the time of assessment. And that's one of the reasons that we meet with our clients every 30 days because things can change quickly and we want to make sure that you're still receiving the level of services that you need.
Great. Okay, and I'm looking at the clock. We've got about 5 minutes and we've got a handful of questions that I'm going to get through here, but feel free to drop in your question here. Let's see. Shoot, where was that one that I was looking at? It was, okay. Tammy says, Florida currently has 3 waivers that are open to children. All are HCBS 1950C Medicaid waivers, and they all waive parental income. Florida also has an adult-only waiver called the Long-Term Care Managed Care, which is September 21st, 2020. And let's see, Sophia says, is there a look back period for the amount of resources?
It they have to look and make sure you didn't just like rename all your resources into someone else's name, the day before you applied. So they do look at some of that. Social services can let you know exactly what those requirements are.
Oh, and Mark, you're a great resource here for our Maryland callers. Mark says, in Maryland, the only way to get Medicaid for home and community services without the long waiting list is to get qualified for Medicaid in a nursing home first. Then you can drop down to assisted living or home care. This is rarely actually done. So, again, just illustrating the differences in the states, but also just really illustrating how unique and special this Virginia program is. I mean, it really, I'm just delighted to have learned about this through you, Lauren. And I think that there's a lot of our audience and readers and clients of our providers that potentially could benefit if they qualify. Let's see, the last, why would you, okay, Sophia says, why would you still want to qualify for developmental disabilities waiver? I'm not sure. That may be a
So that's actually a good question. So the CCC Plus waiver offers a lot of services that we've been talking about today. Those developmental disabilities waivers, the ones that have the waiting list, we still encourage people to apply for those because they actually offer even more services than what CCC Plus offers. So they also offer things like day support services or sponsored residential services. So they kind of the services expand from here. So CCC Plus is a great starting point, but if you have especially maybe a young one with developmental disabilities, it's a good idea to go ahead and get on the waiting list for those DD waivers, even while you're receiving services under CCC Plus, so that when the time comes, your services expand.
great. And then I think we may have answered a question just like this earlier, but I'm just going to read it anyways, and we'll kind of wrap things up here. Is that it says, with the CDC consumer directed care delivery model of care service, does the person or patient, do they need to have needs with ADLs aids to daily living? I'm not sure. Can you decipher that one?
Yeah, so they do have to have those ADL needs. That's part of being able to qualify for the Medicaid waiver. So they generally look for needing assistance in at least 3 areas of your activities of daily living. So that's why when you're being screened, I really encourage families to think through kind of start to finish of those processes. You don't want to answer the question like, oh, they can mostly bathe on their own. You want to really think, I need to supervise them when they bathe so that they can do it safely. Or, mom can take a shower, but I have to help her in and out of the tub so that she doesn't fall. So really think about what you're doing to provide that support, because they are going to look for some dependencies in those areas.
Yeah, and I think that one of the things that that you shared with us, or actually with one of the clients. Whoops, sorry, stop share. One of the things that you shared with one of the clients I referred to you to was that, a lot of times as caregivers, we're really humble. I mean, in terms of we're doing all this work to support our loved ones, but it's sort of like if somebody asks you what you do, it's sort of like, oh, it's my mom, what have you. And I think one of the things that you guys are really good at doing is when people are going through this application process, making sure that they use the correct language, making sure that they're thinking about all the elements that they're doing or that mom and dad needs, so that they potentially have the greater chance of being approved for this waiver. Is that correct?
Absolutely. We always tell families don't sugarcoat it or minimize what you're doing. It's not uncommon for us to talk with a caregiver and have the caregiver say, "Oh yeah, dad Dad doesn't require assistance with eating. I don't feed him. And I say, oh, okay, so does Dad prep all his own meals? No. Well, he doesn't do that because last time he left the stove on. Okay, well, do you ever have to cut up Dad's food? Well, yeah, we do that because so he won't choke. Okay, then he does require assistance with eating. I think so many times we don't realize all the things that we do. It's like parenting, it's the same way. You don't realize all the things that you do for your kids until someone else has to do it. And then they're like, this is a lot of stuff. So we do work with families, kind of coaching them through that process and how to answer those questions.
And I always say this, whenever I say it's the last question, then we get 3 more. So Tracy, who won our award this week because she asked the best questions on another program, says, can we have a program on Medicaid for Maryland? Tracy, one of the things, absolutely, we can put something together. And one of the things that all of you should know is we do a lot of panel discussions with elder law attorneys, and it seems like almost always Medicaid comes up, but this unique Virginia program is really special. But let's do that for Maryland. And then talking about other states, Cheryl Bartholomew says, Lauren, thank you for this amazing presentation and information. I live in Montana and will research to find an organization that provides services comparable to At Home Your Way. And listen, Cheryl, if you don't find that organization, reach out to Lauren, because I'm hoping that with our encouragement, these guys can be nationwide, And then Sophia says, would you encourage this option for those who have serious personality disorders, borderline, and alcoholism, or must it be more physical? Wow, really good question there, Sophia.
We do have some clients. I know we have some kiddos that struggle with the ODD, oppositional defiant disorder. So we definitely have some behavioral health components that we deal with. So it's definitely something we can consider. It's all really individualized. So I wouldn't let that prevent you from giving us a call and pursuing this.
Great. All right, folks. Well, I knew this was going to be a great discussion, Lauren, and I am delighted to let the world know, at least the Commonwealth of Virginia know, that you're a resource here in this state and can help those people. And my heart just breaks every time I talk to somebody that is a Medicaid client, in just knowing how difficult this can be to navigate this journey. So the fact that here in Virginia, there's a resource like yours is amazing. So folks, get out there and connect with Lauren, and we will see what we can do to identify the other states where there might be similar programs. So thanks so much. And
Yeah, thank you.
we will talk to everybody later.
Thanks.